Presbyterian Hospital in New York City, and welcome to SoundBites Cases. In this SoundBites module, entitled Part 2 of Ultrasound-Guided Central Venous Access, we'll look further onto the use of bedside ultrasound to make a more precise puncture attempt on the internal jugular vein during central venous cannulation. As we discussed in Part 1, we first want to map out the anatomy of the internal jugular vein by orienting the probe in both short and long axis configurations to fully investigate the orientation of the vessel. We want to use a dynamic technique for real-time guidance of the needle into the vein lumen, and for this we'll need to place the probe into a sterile sheath barrier to observe sterile precautions during the puncture attempt. Here's the needle coming in underneath the probe in a short axis configuration. Notice that the sheath needle is coming in underneath the probe at a 45-degree angle. And notice that we're using the sheath needle to first determine the location of the internal jugular vein by the ring-down artifact. We would use the same approach for the cannulating needle coming in underneath the probe at a 45-degree angle. As we discussed prior, the probe should be oriented in a side-to-side orientation with the marker down towards our left as we stand at the head of the bed, so it orients directly to the screen indicator valve, which will be oriented towards the left of the ultrasound screen. Here we're localizing the internal jugular vein using the short axis configuration. We're coming in underneath the probe with the sheath needle at that 45-degree plane, pushing in underneath, and notice the ring-down artifact coming in directly on top of that internal jugular vein, telling us this is the correct puncture point. This video clip shows why a short axis orientation is an excellent starting point for cannulation of an internal jugular vein. Here we see the echogenic tip of the needle coming down and permeating the anterior wall of the vessel, and we then note the echogenic tip of the needle squarely inside the lumen of the vessel. And we can see how using the short axis orientation can guide us in a side-to-side orientation on the patient's neck in terms of lateral needle orientation with regard to the surface down to the vessel lumen. When using the short axis orientation, it's important to remember the effect of probe slice on visualization of the needle tip. Here we see the probe position 1 approximately along the needle shaft, and note in the schematic view towards the left, we see the needle with the tip squarely inside the venous lumen. However, the ultrasound probe is positioned more proximally along the shaft of the needle, and thus on the ultrasound view to the right, all we visualize is the needle above the vessel, even though the needle tip is squarely right within the vessel lumen. So we get a false determination of the tip of the needle. In order to accurately determine the location of the needle tip, we need to move the probe more distally as we advance the needle into the patient's neck along the course of the vessel. Here we see the probe positioned more distally, now in plane with the needle tip in the schematic view towards the left. And there we can see we can get an accurate determination of the location of the needle tip with regard to the venous lumen. We see the ultrasound view towards the right, and now we'll be able to see the echogenic tip of the needle accurately positioned within the vessel lumen. A second pitfall that must be avoided when cannulating the internal jugular vein on ultrasound guidance is to make sure that the needle tip does not angle to the side of the vein during a cannulation attempt. Even though we know the orientation of the vessel with regard to the skin, if we don't orient the cannulating needle along the course of the vessel, it can veer to the side of the vessel as shown in trajectories 1 and 2